Hi friends, I welcome you to my YouTube channel Bapat's General Surgery Clinics. In short, BGS Clinics. I am Dr. Pramod Bapat. I have been learning, teaching and practicing general surgery for over 30 years now, as in 2025. There is a huge load of YouTube channels on medical education, and some of the channels are really good. Why add yet another channel then? Well, most of the existing channels impart rather theoretical knowledge. Many channels focus only on solving multiple choice questions. But then, no one talks on how to implement all the information that you have acquired into actual clinical practice. An ability to do so is the crux of clinical medicine. How much ever good you may be at solving MCQs, but still you may not be able to solve the patient's problem. That is, primarily be able to come to a clinical diagnosis confidently if you have not presented cases during your clinical postings. As students, don't we get astonished to see how experienced clinicians quickly come to conclusions in terms of, say, coming to a diagnosis, or selecting an appropriate investigation, or planning the treatment? Is there any method or a system to achieve that level of mastery? Of course, there is. With a systematic step-by-step analysis of clinical data, it is indeed possible to arrive at a clinical diagnosis with confidence. Clinical apprenticeship is a long journey and requires patience, perseverance, and self-motivation to regularly present clinical cases. As a clinical student, you need to learn how to take a good history, how to properly examine a patient, how to interpret the symptoms and clinical findings, and finally, how to draw inference collectively to reach a diagnosis confidently. If you are looking for that guidance, then this is the right place. That exactly is the purpose of BGS clinics. Here, you will learn the art of implementing your knowledge into actual clinical practice. Over the past 20 to 30 years or so, clinical medicine has become a dying art in parallel with the technological advancement. It is good to have a new diversified technology coming in to improve diagnostic capabilities and therapeutic options. But blindly relying on investigations and totally ignoring clinical medicine is a recipe for disaster. And that is what we often get to see around us these days, don't we? Situation is really pathetic. It's deplorable. Patients often lose their life or limb while waiting for hours together for a special imaging investigation to be done instead of an urgent exploration which was clearly indicated on clinical grounds. Why does that happen? Obviously, because of a lack of confidence in clinical diagnosis and consequently going into a highly defensive medical practice, which actually turns out to be counterproductive for efficient and successful treatment. In this channel, I will be uploading classes on how to take history, how to carry out physical examination, and how to analyze the data in a stepwise manner to reach a clinical diagnosis in a host of cases like swelling in general, lymph node swelling, bone swelling, vascular swelling, swellings in different regions of the body such as neck, breast, groin, scrotum, etc., pain in abdomen, lump in abdomen, distension of abdomen, ulcer, sinus, fistula, vascular cases, namely the ischemic limb, amputation stump, varicose veins, and chronic venous insufficiency, oral cancer, assessment of the operated patient, acutely severely injured patient, and so on. The clinical methods discussed here will be useful to you in your practical exams, whether OSCE or traditional, whatever, as well as in actual clinical practice. So, get ready, but don't forget to subscribe the channel. There is a reason. The sequence of presentations will have a sensible order. The videos will not be uploaded randomly, okay? There will be a kind of link between them. The content in any presentation will be based on the topics discussed in some of the earlier presentations. So, if you have subscribed the channel, you will get a notification when a new video is uploaded and you will get to learn the subject step by step in a proper way. The sequence of uploaded videos is maintained in the playlist Clinical Classes. Please watch the videos in this playlist. Thank you very much.